Welcome to Clean and Comfort. Last week we discussed COVID-19 and the challenges of getting into rooms and how we're going to return to our regular scheduled programming. Liz today is our leader. So Liz will be leading this show and we'll take it from there. Liz?
Well, first I want to say hello to everybody. We made it through another week. We continue to see decreasing numbers in our COVID census within our hospitals. And just want to welcome everyone. We have two very special guests with us today. And we're also joined by a special guest that joins us as much as she can. And that's Dr. Carr. Hi, Dr. Carr.
Hi, Liz. How are you?
How are you?
I'm doing okay.
We're joined by Alex, who is the creator and founder of Medama Solutions. Jeff.
How are you?
Jeff. Hi, Alex. How you doing?
Good. Doing well.
Good. Great for you to join us.
Never
Thank
helps
you.
to complain, so why bother?
We'll listen to you. And we're also joined by Jeff. Jeff is a director of an environmental services team, and he oversees an EVS department with 550 plus employees, with more than 3 million square feet to keep clean and disinfected, located in one of the hardest hit regions by COVID-19 in New York City. Welcome, Jeff. We are so happy that you carved out some time and that Alex was able to carve out some time from his very busy schedule. And we value your opinion, and we're so happy that you guys could join us today.
Thanks for having us.
Our
This is
pleasure.
really exciting.
My pleasure.
Great. So I'm sure we have a lot of questions. Dion started to talk about our discussion last week, and we were discussing the HCAHPS survey, and we had a very robust conversation about room cleanliness and how challenging it was during the COVID-19 pandemic to maintain room cleanliness. One of the major challenges for all EVS departments was partially due to PPE conservation, and how EVS had to consolidate cleaning tasks to reduce the number of times we went in and out, and that we were entering airborne and droplet isolation rooms. We also reviewed how every healthcare worker plays a part in the role of maintaining the comfort, the cleanliness, and the quietness within the hospital, especially up and on the patient units inside the patient rooms. And as we welcome the return of our patient experience survey data, we also spoke about the importance of communication and techniques to communicate while wearing a mask. So how's everyone's team doing? Maybe Jeff, we'll start with you. How's your team doing with the upcoming survey data that's going to start trickling in? How are they feeling?
Well, I think the team overall is feeling pretty good. I know that now that we're on the downswing and the numbers from our respective campuses and our organization continue to decrease, and that's very encouraging. We're starting to see a little bit more of normalcy, and the staff are getting back into the regular routines. And all the things that you just listed, I think, are very paramount to our success once we relaunch the collection of patient experience data starting in July. And I think one of the best things that could have happened, I call it the silver lining of this cloud from COVID, is that because we had to flip a lot of units, we severely decreased our visitor population and visitor flow. That surprisingly, a lot of the work that EVS specializes in is with floor care and with detailed cleaning and the things that we try to get to on a regular basis that could be a challenge at any given time. And we've gotten a lot done, and especially for a building the size of the one that I oversee, it's really incredible to see all the great work being done. So I think we're in a great place to start off strong with our patient experience data. And I just want to comment that you made a great point about, how are you doing effective communication when you're wearing a mask? And I think that's going to be a unique challenge, but I think that, the heart of our team, shines through even through that face covering. And I think that's going to be a big weapon in our arsenal to increase our scores.
Yeah, we agree. Dr. Carr took us through some really great information, great ideas and ways to teach our team and coach our teams on how to communicate with masks on from the perspective of a patient. So Dr. Carr, that your message resonated this week as I did team huddles and started to speak about some of the tips and great hints that you gave us also. Those tips were really great.
Oh, that's great to know.
Yeah, the team really enjoyed it, and I think we all have a little more wrinkles under our eyes because we were really practicing our big smiles. So our cheekbones turned up and patients could see we were smiling. So that's a really good point. So Jeff, you mentioned floors, and there's this old saying within environmental services that shiny floors equal higher scores. And I think this is a great segue into Alex and having him speak about his Medama solutions and how hospitals and other healthcare facilities can use his products to really make a difference in their floor care program. Alex, tell us about Medama Solutions and what made you create a product for hospitals that was as shiny and as easy to maintain as Medama.
Well, one of the things that we found now, especially now with post-COVID, when they're turning over all these rooms, it really gives an opportunity for a director of housekeeping of operations to really think about, what we can put down on the floors so that the next time we have to deal with the floors, we don't have to invest so much time and labor and aggravation, especially now when staff is very short because of COVID. We don't have the same staffing that we had before, and we have much more demands that's put upon us to disinfect where we didn't disinfect before because we don't know who's going to be coming in that's COVID or non-COVID. So because of the staff being strained and all those challenges that are being thrown at EVS directors and operations department, we feel that bringing Medama products like Iron Coat and Super Shield into the program is very beneficial for a couple of reasons. One of the challenges that directors and floor techs and floor operation managers deal with is getting into a floor and repairing the floor as quickly as possible and doing it in a way where you talk about HCAPs, where we don't disturb the environment of the patient, we don't disturb the nursing staff from doing their job or the doctors from doing their job. And so if we can get into a floor and turn over the floor in a matter of half an hour to an hour versus stripping and recoating and closing down the area for 3 or 4 hours, we're ahead of the game. And so products that we've developed in Medama are basically focused in on eliminating stripping as much as possible. And we successfully have done so over the past couple of years. Close to 90% of the floors that would normally be stripped, we're able to restore in a matter of minutes with a scrubber and a burnisher. And then we recently came out with coatings that actually are resistant to the Purells, because now, especially now with COVID coming in, the amount of sanitizer that was being used in hospitals went up incredibly. I mean, where you didn't have sanitizer before, it's now everywhere you can breathe. There's another dispenser or a bottle or someone pumping away hand sanitizer, and even the use of hand sanitizer has gone through the roof. So the hand sanitizer, because it's an alcohol, comes from the word alkaline, it tends to strip or remove or damage coatings that are traditional in our industry, whether it's a floor finish or whether it's in the different polymers that they now use on the floors. Most of them get attacked by these alcohols. And with Iron Coat and Iron Coat PR, both products that we've introduced under the Medama name, both products are resistant to alcohol. They're easy to strip and remove when you do need to strip and remove it, but you really don't need to because it really does hold up and it doesn't turn yellow like traditional finishes. So it gives the opportunity to the staff to put these coatings down that are very tough, alcohol resistant, give you a very high shine. In fact, the polymers that we use in the Iron Coat products are basically designed to get better over time, almost like a wine. As it cures and the moisture escapes from the coating, it actually hardens and becomes a better product than when we initially put it down. So you actually have an improved shine over time. And that together with Super Shield, which is now cleaner, we really hope that we give the opportunity for the staff to get a product down that they're not going to have to strip for many years to come. So it's really a once in a lifetime opportunity to do this because of COVID. Sadly, because of COVID.
So thanks, Alex. So the next set of questions I would like to place to Jeff and Dr. Carr. And Dr. Carr, from a outside-in perspective, from a customer perspective coming into a hospital, and Jeff is the director of environmental services, and now we have COVID. COVID is going on. What do you expect from a director of environmental services to have ready for your visit in this hospital, that you have all types of things in your mind going on to keep it safe for you? And Jeff, you can answer that question.
Well, from the perspective of environmental service, as I just heard one of the best statements, clean floors mean higher scores. That's one of the first things that I look at to see how clean the environment is that I'm walking into the hospital. So definitely the floors, because as we all know, the floors get the greatest impact from us walking in and out, and it kind of keeps track of how much traffic comes in and out. But if you can kind of lower that or remove that from my conscious mind and make me feel or make me see that the environment is clean. We know that the hospitals have lots more traffic going back and forth, in and out, because more people are sick. So that is a sign and a symbol to me that you all are doing your job. Also, when I arrive into the room, I would like to see that the place is clean and in order. And as I stated last week, I might have a different perspective because I do understand that cleanliness in the rooms is a team effort. Not only is it the responsibility of environmental services, but also we have to keep in mind, it's in my conscious mind that also the nurses, when they're using Band-Aids or whatever they're using, they have to make sure that those items are discarded of properly as well. I don't need to see blood stains anywhere on the floor. I don't need to see these things. One of the things that I do expect from the staff, if I was staying in the hospital, is greetings when you come in the door. Those who are coming in to do the job, please greet, hi. Don't just walk in and start cleaning up and I have to guess who you are. But greetings, hi, good morning, good afternoon. Next thing, explain what you're doing. I'm going to clean the room or whatever it is, so that way we have some kind of communication, as we spoke about before, which is very important. Do your job, which is clean whatever you're supposed to do, and exit out of the room. If possible, if you are using a product that will have a really excessive smell, I would rather be removed from the room, because so that way I can have a sense of safety. We know that a lot of cleaning products have long-term effect with lungs and kidneys and things of that sort. But that is what I will be expecting from the aspect of the patient.
And I think those are all fantastic points that you pointed out, Dr. Carr. I think from that first impression you walk into a building, usually we often say that, if a surveyor walks into a building and everything's immaculate in the lobby, the floors are shining, the pathway is clear, usually that's off to a good start. And we want the patient to have that same experience as well. Clean floors mean higher scores. I've never heard that phrase before, and now I'm going to use it, and it's absolutely correct. That is very catchy. I like that. I'm going to steal it. But everything else that you talked about, and I think visibility is key. Staff should be highly visible, being able to take on the environmental services tasks, and they should be in plain view of visitors, family members, because